I am Shannon Weber with Hive, a hub of positive reproductive and sexual health. It's December 2015 here in Atlanta, Georgia at the National Prevention Conference. Talking with?
Hello, my name is Charlene Flash. I'm a researcher and clinician at Baylor College of Medicine in Houston, Texas. I also take care of patients in Harris Health System, which is the safety net for the poor and underserved in Houston. And I see HIV infected patients at Thomas Street Health Center, which is a fascinating place that serves about 5,000 HIV infected patients in Houston, Texas. And I, about 3 years ago, started an HIV prevention program there where we provide PrEP.
Yeah, I want to talk with you about the PrEP clinic because it's so innovative, and you guys were one of the first places, particularly for a standalone HIV clinic, to start offering PrEP. So when did you start, and what made you start?
You know, I moved to Houston from Boston about 3 years ago, in part because it was just a wonderful opportunity to serve in a very underserved area. And at Thomas Street, aside from a very robust HIV treatment center, they also have a robust HIV testing and counseling program where they were testing 800 people each year and had very high incidence rates, lots of positives. And so I said, well, you're having all of these very high-risk individuals. What do you tell them? And they talked about the counseling and testing that they would do, and a lot of it was about condoms and STD testing and treatment, but also come back in several months because you're so high risk, you should be tested again in 3 months. And so this was shortly after Truvada had been FDA approved for PrEP. And so I said, well, you know, we have this new tool available, and you have this opportunity, this harvest of individuals who could benefit from it. What is there something that we could do here to implement a program? And that's how it started.
And so how are people referred to the PrEP clinic?
Oh, so that's an interesting question because our referral pool is pretty broad. We do receive referrals from within the clinic, so people who are the HIV negative partners of the HIV infected clients, but also we receive referrals from the health department when they encounter people who have had multiple sexually transmitted infections over the past several months, or from providers in the community who may have a primary care patient who has had multiple sexual partners, multiple STDs, or for some other reason seems to be at excess risk for HIV, or people who are just in the community and are availing themselves of walk-up HIV testing, and then in talking with them, you realize that they are at high and undue risk and potentially could avail themselves of something in addition to protect themselves.
I think that's one of the things I love the most learning about your clinic is how it started to really offer this HIV prevention continuum. So there's these places people can get referred to the clinic, but here you have this HIV testing clinic. And if people are negative and they're at risk or ongoing risk, they can get referred to the PrEP clinic. So beautiful.
You know, for us, I think one of the catchphrases for us is each test is an actionable moment. So if someone tests HIV positive, you link them to care as quickly as possible. Send them right upstairs. If someone's HIV negative and you also have identified them as at high risk, that also is an actionable moment because now we have additional tools in our arsenal.
Right, it's great. And if women come to the clinic, so they get HIV tested, then they end up at the PrEP clinic and they want to have a child?
Oh, so that's wonderful. When women come through the HIV prevention program, many of the women don't even know that childbearing is still an option for them. They'll ask and they'll wonder. And so it's really a wonderful opportunity to help these young women avail themselves of this when they thought that maybe this was not going to be a part of the picture for them. For those women, we do counseling and around the possibility of safely bearing a child. We also refer them to our OBGYN, Dr. Levison, so that Judy Levison is fantastic, so that she can do some of the counseling surrounding Truvada and its safety for women who
and that's all in the same clinic too, so it's
exactly the
so
same
easy
building
for people.
Very easy.
And maybe wanting to have a child could be an actionable moment. Maybe.
Absolutely.
You know, I love that. Okay, so what has surprised you since starting this clinic 3 years ago?
Oh, so that's a very interesting question. I guess the most surprising thing is early on, and understandably so, many of the ancillary staff in the clinic and even some of the administrators were hesitant about the idea of PrEP. It had just been FDA approved. Was it clear that it would work in non-clinical trial settings, and particularly in our setting where we're really serving the poor and indigent and people who some might assume might have adherence challenges because of their social milieu. Now, 3 years later, we have so many success stories, and some of our greatest initial doubters are now some of our greatest supporters. And so at the beginning, we spent a lot of time providing our ancillary staff and other providers in the clinic with education and information about PrEP. And so it's really nice to see that that paired with patient stories has helped people move along that continuum to understanding that this is actually a really important tool that's not an end-all to the epidemic, but an important piece of solving the problem.
Expanding the options. It highlights the value of not just training providers, but having training and support for all of the clinic staff, and that really without all of the clinic staff we can't do this successfully.
That's absolutely true, because so often some of our referrals don't come from clinicians. They come from the pharmacist when a partner comes up to pick up her partner's patients. I've had the security guard send people our way when they drive up to pick someone up from their appointment. So things of that nature. So really having people at all levels within the clinic aware. It also gives patients, when they come, a different sense of support when all the people they encounter are rooting for them and for their success in maintaining their HIV negative status.
So great. Talk to me about women.
So as I think about some of the stories and some of the women I've taken care of, there are many interesting anecdotes I could share with you, but two that come to mind. One in particular, I had a young woman who had been HIV infected for several years and had been very well controlled. For 10 years had an undetectable viral load. And so I guess this is in some ways a story about her husband. But her husband and she came to me for a consultation, and he said, you know, I want to get on PrEP. And I said, well, your wife seems to have been so well controlled for so long. And he just was so insistent. And I said, well, you know, PrEP is not an anti-anxiety pill, but I am willing to have you trial the medication for 6 months, and we'll see if anything happens, because sometimes people have blips or things change in their life or have outside partners, and we'll see what happens. And about 3 or 4 months into it, they came for follow-up, and we realized that the wife had completely stopped taking her meds. Her favorite uncle had died, and she entered a severe depression, and her viral load went up into the thousands. And we were all so relieved that he was on PrEP. And it really made me as a clinician rethink my own perspective about who's appropriate, and realizing that that decision is very individualized. And sometimes when the patient says, something's just not quite right, something's just not quite right, and you have to go with that.
And then maybe people asking for PrEP in and of itself is an indicator for us that there's something there.
There's something
to
there.
be curious about.
And so I don't think that for someone, I would just have them on it forever, but I've decided that I'll offer it for that 6 months. Let's see what happens.
Yes,
Let's give them a trial, because life changes and people go through seasons of risk, seasons of transition, and it allows life to happen as well for them. The other interesting stories of a young woman who was of African descent. Actually, she's born in Africa, immigrated to the United States, and she was married and found out that her husband was HIV infected. He quickly got into care and also had an undetectable viral load initially, but their marital life had suffered. She could not bring herself to have intercourse with him because she just looked at him and thought of the infidelity. She thought of the risk she was potentially putting herself at. And now we have an individual who, once she got on PrEP, their sexual life blossomed and their relationship completely changed. And now they actually, she's actually pregnant, which is a very powerful thing, because culturally for her, having children was such an important part of their cultural experience that she had just resigned herself to not ever being able to avail herself of. So it was really life-changing for her. So many times we think about the data and we think about PrEP as a biomedical tool, but we don't think about the social impact and what it does to help people feel safe in their relationships, to give them back power, in their relationship, so you're not depending on someone else to put on a condom, or someone else to take a medication, or someone else to respond to your nagging to take their medication, right? But it's something that women and men can take on for themselves that allows them to take their protection into their own hands.
What I love about this is the message about how feeling empowered can be healing. You know, on whatever level that is, if that's healing yourself, or in the case of this story, healing in the relationship, and that's so beautiful.
It is really beautiful and really empowering. And I think sometimes when people think about treatment as prevention, they don't realize that, especially in marginalized communities, the other partner is often just not empowered to navigate condom use. These are the communities where things like sexual violence, things like the partner not really disclosing what their actual numbers are, or what their pills are, or the details. It's just not your business to know those details about my life. That so often in this particular community, that's just not part of the story. So then to tell that person that they're putting their future, whether it's HIV positive or HIV negative, in the hands of that other person, really kind of creates a power imbalance, or exacerbates the power imbalance that's already there.
Yeah, it ignores the truth of people's lives.
Exactly. We're giving people power back.
And yeah, I think that too about people who are living with HIV. Who says that they're required to disclose their numbers? I mean, when do you get to have choice about your privacy? So to just say that there's only one way that you can have a relationship between two people is not the reality of people's lives. So
Absolutely true.
so beautiful. Thank you. Thank you for being such a champion and taking this forward, especially in Texas, and for all your commitment to women.
Oh, thank you so much for the opportunity to speak with you. It's been wonderful.